Did you know one of the commonest innocent heart murmurs is called the Still's murmur? This is named after the first English professor of paediatrics, Dr. George Frederick Still, who was a consultant at Great Ormond Street. He described this innocent heart murmur in the early 1900s, and he described this as a vibratory type noise. Hi, my name is Dr. Tristan Ramcharan, and I am a consultant paediatric and sport cardiologist based in Birmingham. Today I want to talk to you about heart murmurs. So what is a heart murmur, and what does it mean for you and your child? Well, one of the commonest referrals I get in my practice is for evaluation of a heart murmur. It could be a newborn baby or a teenager. So what is it? Well, simply put, a heart murmur is the ability to hear the blood flowing through your child's heart. This is very, very common. It's seen in 9 in 10 children at some point in their life. And this can be because of a hole or a narrowing in the heart, which is why we get children checked and why people are referred to me to be assessed. But however, more often than not, it's because of a coexisting high temperature or low blood count. Or the murmur may be noted incidentally when examined because of another reason. For example, your GP may have listened to your child's heart because you went for a chest infection and suddenly heard a heart murmur. And of course, this creates significant anxiety for you as a parent and your family. All of these reasons, the blood flows faster through the heart, and this gives the extra sound of a heart murmur. Usually the murmur sounds differently depending on the reason. It can be harsh and loud because of a small hole in the heart, or it can be softer when the blood flows faster through the heart for other reasons. Murmurs can also be innocent, with no cardiac problem, but be present for many, many years. I liken this to musical quality. As the blood flows through the heart, it passes over the cords around the valves in the heart. It sounds almost like the strings of a harp. Usually, I can differentiate these just by listening to the heart with my stethoscope. But I usually confirm these with an ECG, which is an electrical tracing of the heart, and an echocardiogram, which is an ultrasound of the heart. This allows me to confirm that your child's heart is structurally and functionally normal, or if I think there is a heart problem, to confirm this. I do all these tests in the same appointment with results communicated at the same time. If there is a problem, I will discuss this with you, explaining this in as simple a way as possible, and we'll talk through the management options and follow-up plans for your child. If it's innocent, I will obviously reassure you and go through this with you and explain that there's no further follow-up needed, but I will be happy to take any questions and go through this in as much detail as possible for you.